ಇನ್ಸಿಷನಲ್ಲಿ ನಾವು ರೊಬಾಟಿಕ್ ಸರ್ಜರಿ ಮಾಡಿ ಬ್ರೆಸ್ಟ್ ತೆಗೆದ್ಮೇಲೆ ಅದೇ ಇನ್ಸಿಷನಲ್ಲಿ ನಾವು ಟೈಟಾನಿಯಂ ಬಾಡಿ ಪ್ರೊಫೈಲಿಂಗ್ ಮೆಶ್ ವಿತ್ ಇಂಪ್ಲಾಂಟ್ ಹಾಕಿ ಬ್ರೆಸ್ಟ್ನ ರೀಕನ್ಸ್ಟ್ರಕ್ಟ್ ಮಾಡಿದ್ವಿ. ಸೊ ಈ ರೀಕನ್ಸ್ಟ್ರಕ್ಟೆಡ್ ಬ್ರೆಸ್ಟ್ ಆಪೋಸಿಟ್ ಬ್ರೆಸ್ಟ್ಗೆ ಮ್ಯಾಚ್ ಆಗದೆ, ಅದರದ್ದು ಶೇಪ್ ಆಗಲಿ ಸೈಜ್ ಆಗಲಿ ಎಲ್ಲ ಆ್ಯಬ್ಸಲ್ಯೂಟ್ಲಿ ಮ್ಯಾಚ್ ಆಗುತ್ತೆ. ಆ್ಯಂಡ್ ನಾವು ನೋಡಿರೋ ಪ್ರಕಾರ ಪೇಷಂಟ್ಗೆ ತುಂಬ ಅದು ಕಂಫರ್ಟಬಲ್ ಆಗಿದೆ. ಕೆಲವರಿಗೆ ಇದಾದಮೇಲೆ ರೇಡಿಯೇಷನ್ ಕೊಡ್ತೀವಿ, ರೇಡಿಯೇಷನ್ ಅದಕ್ಕೆ ಏನೂ ಅಫೆಕ್ಟ್ ಆಗದಿದ್ದೀರ ಹಾಗೆ ಇನ್ಫ್ಯಾಕ್ಟ್ ನಮ್ಮ ಟಿಶ್ಯೂ ಅದ್ರ ಮೇಲೆ ಬೆಳೆದು ಪವರ್ ಏನು ಇಫೆಕ್ಟ್. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
Robotic nipple spreading mastectomy, which is an advanced surgical technique. And the advantage of this technique is that we put a small little cut or incision in the underarm region, and with the help of the robotic machine, we do the surgery wherein we leave the healthy skin and the nipple intact, and we remove the breast within this cover. And once we remove the breast, we fill the gap with what is called as a silicone implant. So with a small cut, the breast
exemplifies to kindly give a welcome speech and set the context for
go out into the community and make the lives of people much better. And even in Karnataka, we've lived up to that legacy. You know, back in 2006, we started the first comprehensive cancer care center to give a new free lease of life to women who face or who suffering from breast cancer, and not just doing it robotically. The interesting part of this procedure is a novel use of a titanium implant.
What are the newer things happening and how they can make use of this technology? So, as we know that breast cancer is the most common cancer occurring in Indian women, and it accounts to 9.4% of all cancers, 40 to 50 years. Now we know that the incidence of breast cancer is on rise, yet it is a very treatable cancer. Breast cancer amongst all the cancers has one of the highest 5-year survival rate, which is about 81.89%. That means a patient who develops breast cancer, she takes treatment, and there is a very high chance that she will recover from breast cancer. Also has a social issue associated with it because cancer is concerned. Now, female breast is a symbol of beauty, motherhood, vitality. It can severely affect a woman's self-esteem, cause depression, anxiety, and we have also seen our OPDs that it affects the interpersonal relationships. There are issues of femininity need to be considered when we are planning the type of surgery. And in this arena, a lot of changes have happened as far as surgical management of breast cancer is concerned. In the past 3 decades, remarkable advances in de-escalating breast cancer surgery, keeping the skin and the nipple intact. Only the breast within this envelope of the skin is removed. So, what are the advantages of robotic surgery? We have a 3D small tiny little camera which gives us 10 times more magnification. We can see the blood vessels, we can see the nerves very, very clearly. And there is what is called as endo wrist. We have a wrist, but the robotic arm, the wrist movement is much 10 times better magnification. The incision or the cut is very small. So the recovery from the surgery is faster. There is lesser pain associated, better cosmetic outcomes. There is hardly any blood loss, and psychologically it gives outcomes which are very favorable for the patient.